erectile dysfunction is a very, very common complication post prostate surgery, or with alongside urinary incontinence. I think 90% of men are going to be urinary incontinent post surgery, and maybe about 70% of men, 75 to 70% of men are going to be have erectile dysfunction as well. And that is really because, when really with erectile dysfunction, it depends on what sort of surgery you've had. Like the urologists do their best to preserve the nerves and the nerve endings around the prostate. But sometimes, if the prostate is touched, the end is towards the end of the, if the cancer is towards the end of the prostate, then it might be hard for the surgeons to actually preserve the nerves. So they kind of do a unilateral or might do a bilateral nerve sparing procedure depending on where the cancer is on the prostate. But that actually will determine if how that erectile dysfunction kind of turns out to be post surgery. So yeah, I think because those nerves will initiate they will supply the muscles to and do the initiation of the erection. So it kind of will really depend on the type of surgery. But then again, it can affect 6 weeks post surgery. That's when all that soft tissue healing can take place as well. So we kind of say to patients that it's going to take at least 6 weeks before the surgery, the trauma of the surgery is actually sort of dissipated and all the inflammation has improved. And then once that part is once all the natural healing has taken place, that's when we'll kind of think that the erectile function will start to come back once the blood flow is starting to infiltrate back into the bulb of the penis there. So, but leading up to that, we can always work with patients to try and initiate or activate the right pelvic floor muscles. So then when the bulk of the healing has taken place, we can really start to build on the exercises a little bit more from maybe initial isolation or activation of those the right kind of urethral muscles, to then building on them once that natural healing process has taken place. Really, well, there are those patients that do really well straight from post-op, and they can wake up and have an erection and but that is quite a small minority that happens, and that might be because the surgery went really well, they preserved both nerves. But for the guys which may have only had unilateral or bilateral nerve sparing procedures, then it can take 6 weeks for the nerves to start to heal itself, and it's called neuropraxia when the nerve gets affected. It's like the nerve's been cut, so it can take that 6 to 8 weeks sometimes for that nerve to start to heal itself in in a bit more of an efficient time. But there's medication that we can use. There's a medication called PDE5s, and it's things like Viagra, Cialis, which is quite a common one that the surgeons like to prescribe. But usually they like to wait around the 4 to 6 week mark to make sure that we really want to try and wait to see if that spontaneous natural erection comes like on its own with natural healing, or if people do need a bit more help than that the medication is definitely there to assist with that. It can actually last for long into years as well if people do need that backup of erectile sort of support. There are other options as well, such as the injection. So if you can inject the the bulb or the base of the penis with a medicinal product like Viagra or Cialis as well. So that is another option if you've had a bit more bilateral nerve sparing procedures, which is that both nerves have been cut, which means it's very hard to really achieve a full erection by physiologically. Then the medicinal products would be there as an option to really help achieve that. Obviously it kind of takes away that spontaneity, when because it kind of gives you a 30-minute window of needing to be spontaneous, but it is definitely an option, a great option for a lot of people with those procedures, really. If once they've had, we ideally would like to see patients pre-op, before, the evidence shows anywhere between 4 to 6 weeks pre-op, which leads to really positive and better sort of post-operative outcomes, really. I suppose it's like having any kind of operation. If you had your knee or your shoulder, operated on, or if you're going in for a knee replacement, the stronger you can make your muscles pre-op, this leads to better outcomes post-op, really. And that's just because you've been, what we would do more muscle activation type exercises. So that's when we would use the ultrasound for about 4 to 6 weeks prior to try and address, to see which areas that need the most needs the most support and activation. And I suppose it's kind of a process of having motor learning pre-op, which is like learning a new skill. So you can't really hit a golf club really, really far without actually learning the skill first. And that's the same as having using your pelvic floors, because most men, they've never even seen or heard of pelvic floors. So it's about really trying to see which muscles they need to activate, trying to use a block practice approach of lots of repetitions, 3 to 4 times a day in different positions as well. So standing, lying, sitting, and then you might do that for a good period of weeks before the operation, and then after the operation, you would normally wait about a week because you're going to have the catheter in for about a week. So the surgeons don't really like us getting involved too much and doing lots of pelvic floor. It's we want to wait to have the catheter out. And then once you've had the catheter out, you would come back to see us. We would do another ultrasound assessment to see where you're at with your pelvic floor work. A lot of the time it's going to be a lot weaker, because it's been a very traumatized from the procedure, which again can take 6 weeks to improve. But that's when we would try and use the ultrasound again to try and get that muscle activation. But if we've done it pre-op for 4 to 6 weeks, it's going to have a better better motor sequencing effect, and then we can start to build on the strength and speed a lot more efficiently if we've seen you pre-op for say 4 to 6 weeks, really. So if someone is waiting for their op, please get in contact with me, Jack at Complete Physio. All of the details are below, and look forward to helping you in your recovery soon.